Okay, guys, today I thought I would discuss whether reverse quarantine is a good strategy to control COVID 19. Now, reverse quarantine, as we all know, is nothing but restricting the outside movement of people above the age of 65. Now, the assumption is that post 65, your immune system weakens. The big question before us is whether this assumption is right or wrong. In my opinion, this assumption is utterly and completely wrong. The reason is there is no clear-cut correlation or study which establishes the correlation between age and immunity. There is no clear-cut correlation. What is available is a correlation between diabetes and the immune system. It has been proven without a shadow of doubt that diabetes weakens the immune system. And generally, what happens is people of ages beyond middle age would generally have a greater possibility of becoming diabetic. And in such people, the probability for immune system weakening is pretty high. So the correlation is between diseases like diabetes, which weakens the immune system, and the possibility of getting COVID because the immune system is weak. But then this is a correlation between diseases which cause a weakening of the immune system and COVID, possibility for getting COVID. Is not a correlation between old age and COVID. So what we have witnessed is COVID has actually caused mortality in a large number of people across ages, from kids to youngsters to middle-aged to old-age people. And there is no clear-cut correlation between age and COVID-related mortality. But then there is a correlation between COVID-related mortality and diabetes. So we are actually mistaking the correlation between a disease condition and COVID with a correlation between age and COVID, which would be a preposterous and absurd thing to do. Now, the COVID affections, 80% of the people who are affected may not even show symptoms. They are asymptomatic. Out of the balance 20%, 18% develop mild to moderate symptoms, which are not harmful. Only 2% face mortality. And this 2% actually faces mortality primarily because their immune system is rather weak. And this weakness leads to mortality rather than age. So, we must establish the correct correlation between COVID and the immune system and not be taken for a ride with false notions, misinterpretations, and unfounded conclusions. Thank you very much.